So, one of the most commonly performed surgeries in the world is actually the sleeve gastrectomy. And it has gained a lot of popularity. I think one of the things is that insurance coverage started covering it probably about 5, 6, 7 years ago. And it's a very widely performed surgery. With the sleeve, some people view it as a completely restrictive surgery where basically you're just making something smaller. But it's actually a truly metabolic surgery where it's changing a lot of gastric hormones, neuroendocrine hormones to very much affect people's, again, relationship with food, where their satiety, their fullness is changed, their cravings and desires for foods are changed. And that's through a very important neuroendocrine tumor called ghrelin. With the sleeve, what's being done is it's a laparoscopic procedure, small incisions. It's a surgery that takes the surgeon maybe about 45 minutes to an hour to perform. It's a surgery where most patients are able to leave the hospital after one night and then go home. Surgery that patients are usually going back to work within a week to 2 weeks. With the surgery, what's happening is the stomach's kind of about the size of a football. And we have to take down the blood vessels on one side of the stomach. And then a certain sizing tube is placed down the stomach, down into the stomach. And a staple firing is done up along that sizing tube so the appropriate size of the stomach is made. And then that old stomach, probably about 80% of the stomach, is completely removed. In doing so, you remove that gastric hormone, ghrelin, where that's the portion of the stomach where it's made, and that very much affects people's cravings and desires for certain foods. We want to make sure that the staple line heals well, and I would say that's one of the biggest concerns with these surgeries. Now, thank goodness, when you're talking about risk of something like the sleeve, you're looking at that staple line. If there was not going to be a healing process, say a leak happening in the staple line, it's on the order of 0.2 to 0.5%. Other risks we worry about is blood clots or pulmonary embolus is on the order of maybe 0.3%. So these have become very safe surgeries. As in everything, each day after the surgery should be getting easier and easier, and if there's a problem, we absolutely want to know about it. The other thing is what to expect. With the sleeve, most patients would expect pretty aggressive weight loss over the course of the first 6 months and really over the course of a year, but after the first 6 months, the weight loss does slow down. And what kind of weight loss to expect? We gauge that again with the kind of more excess body weight loss. So if somebody has about 100 pounds to lose, with a sleeve, we expect them to lose 50 to 60% of that. So that would be about 50 to 60 pounds for every 100 pounds that somebody has to lose. We really see great results with the sleeve. I think it is a tool, as you've probably heard in other types of videos. It's a tool that with the right support structure afterwards, patients can do very well with, in concert with the right lifestyle, exercise plan, and good follow-up. Thank you very much.